My vision kind of got a little crazy when I first was diagnosed with my tumor.
In the summer of 2014, we got the diagnosis. She has a pilocytic astrocytoma, which is an optic glioma, 3-centimeter mass near her optic nerve.
So we have the diagnosis that's causing all these issues, whether it be for vision or, the headaches. So we originally started with traditional chemotherapy.
So after the first 10 months of treatment on chemotherapy, she had a couple years where she was off. At an MRI, the oncology team decided that we needed to continue treatment again. They presented us with a couple different options, and a few of them were a part of the Experimental Therapeutics Program, and that's what started our clinical trial journey.
Here at Children's, we were very fortunate that the Experimental Therapeutics Program is the largest early phase clinical trial program in the Rocky Mountain region. We have patients who are referred here from all over the country, and we have treated several patients that have been international as well who have come for specific trials available here. The goal is to move science forward and to really find those next therapies that will treat these relapsed and refractory tumors, or tumors that have come back despite best therapy. But an additional goal that I have and that the program has is to offer families hope and the opportunity to have the ability to try these therapies to see if it works for their child.
That's what trial's for, right? Is to find new treatments. So at first, while it was frightening to not know, it was also exciting to know that she was going to be a part of something to help future kids that may be diagnosed with this.
I actually said yes to the trial. We listed out the pros and the cons of being on the medication. My main reason was that I'm helping kids out, and that's what I want to do because there's kids like me out there who need the medication.
She initially enrolled on a clinical trial that we were part of, and it was a novel agent to target the mutations or the changes in her tumor DNA.
I was a little less than 2 years on the trial. It worked really well. It shrunk my tumor a ton.
The trial therapy ended and she was off treatment for a while, but then her tumor started growing again. So she came back to us for a different trial that actually came out of work that was done here at Children's Colorado in partnership with the University of Colorado investigators. Before we had the ETP program here, families had to travel elsewhere to other institutions for trials. And we now have those trials available here. We have somewhere between 50 and 70 clinical trials for different tumors and different types of patients, but we try to have a trial, if we can, available for patients so that they get the care they need.
The first clinical trial that she was a part of was actually approved as treatment for this type of tumor. So she was a part of something that effectively is changing the course of treatment for these kiddos, that maybe they don't have to go through what she went through the first time. So knowing that she was a part of something to better the treatment and care for children kind of made it an easy decision for the next clinical trial.
I said yes to the second trial, and that was the most recent one I was just on. They were good enough to get my tumor to stay stable and shrink a little bit, so that's when we stopped, and here we are today.
The reason why pediatric oncology has been so successful is because of people's participation in clinical trials and in clinical research. Our trials that we have done across the country through the Children's Oncology Group and other consortium have what's moved the needle in survival rates. And that's how we continue to make things better, whether we have better survival rates or fewer side effects. When it comes to experimental therapies or therapies that we don't know all the side effects for, we don't know if it's going to work, you really do want to experience those drugs or receive those drugs under a clinical trial because we are extra careful. We spend the time to make sure that we are following all of the rules and regulations, but also making sure that we're detecting side effects early and treating them as we need to.
When you're there, you feel like your child is the only one that matters. That's the type of service that they give you. With the clinical trial, we were there every week. They checked everything. They did lab draws more often. They did eye exams more often. So they were watching for even the slightest bit of change.
Clinical trials are not easy by any stretch, and they're not smooth. They are exactly that, a trial. They have ideas, they have hypotheses about what's going to happen. But when we saw the results, it made it all worth it.
So at her last MRI, she was 3 months post end of treatment.
So when Dr. Vivekar came in, it basically came in and said that, hey, tumor hasn't grown at all. If anything, it shrunk a little bit. And the relief that we felt was just immense.
I felt excited. I was very relieved that the tumor had stayed stable.
What's next for Maelle then?
8th grade. I'm coming. Bye. Bye, 7th grade. Yeah, I don't know, just living my life as a normal kid and not forget, but get past everything I've been through from 4 till now, and just hope that everything's gonna be great from here on out.